And if you are going too fast, I will let you know.
Okay.
Start up.
You can go, Frank.
Okay. Good evening, everybody. My name is Frank Camerata, and I am the Executive Director of the Erie County Office for People with Disabilities.
And I am Patty Ann Gasinski, the Training Coordinator for the Erie County Department of Health Office of Public Health Emergency Preparedness.
And we are very happy to join you this evening to talk about disaster preparedness or emergency preparedness. We would like to note that September is Emergency Preparedness Month. Granted, it is October, but Patty Ann just pointed out to me that disaster emergency preparedness is something that needs to be celebrated and thought of every month of the year. So we're very happy to meet and provide information to you this evening. So without further ado, let's start the show.
Great, thank you. Could we have the first slide, please? So preparing for emergency situations is actually fairly simple. The key is to think about it ahead of time. So there are some action steps to being prepared for an emergency, and we're going to go into a little more depth with each one of these a little bit later in the slide presentation. So the first thing we have to do is to get informed about what disasters we may face. We have to make a plan to respond and prepare for those. We have to have our home emergency supplies and our car supplies and other go kits ready to go. We need to maintain our plans and kits and update those. And then we need to address each of our own individual needs to be prepared. Next slide, please.
So we need to get informed. And we want to describe types of disasters that may happen in our area. The first one is flooding. We know that we live with the Niagara River. We live near Lake Erie. We live near a number of waterways that could flood at any time, especially during the winter when we have the thawing snow and the thawing ice melt. There may also be hazardous material spills. There may be fires. We may have winter storms. In fact, what was it, 15 years? I think it's 15 years next week when we will be, I don't know if you want to say celebrating the surprise October storm that affected the North Towns, but we have winter storms that happen without notice. We also have disease outbreaks, which apparently we are going through right now, right? And we have heat waves. Next slide, please.
So why is it important to plan ahead? We're going to ask you that. So if we have a way to hear from our audience, we want to know why you think it's important to plan ahead. Everybody got your thoughts in your head? All right, so let's go on to the next slide. So one of the reasons we want to plan ahead, number one, is to have a sense of peace. Instead of worrying at the last minute, am I prepared to handle this? What do I need to have? You always feel a little better and a little more mastery of the situation once you're prepared. It also, if you're a parent, helps you prepare your children. It gives them a sense of security. It also helps all of us as a community because during an emergency situation, our resources may have to be divided up into many places around the county. So if each of our citizens can be as ready as they can be, that little bit of preparedness goes a long way to help each other in the community.
So different types of preparedness plans that we need to think about at all times. First and foremost, a personal plan of preparedness, a personal preparedness plan. Think about it for both your home or your workplace, for your car, for any place that you're going and spending time at. The next one we want to talk about is a family preparedness plan, which includes everybody in your household. And we want to make sure that you don't forget your service animals or your pets. And then we also want to talk about a workplace preparedness plan. Educating your coworkers on disaster preparedness is vital. It's important that when you're at your workplace that in fact I work in downtown Buffalo, so I have a to-go bag. I have snacks in my drawer. I have a toothbrush. I have all of those things that just in case I'm stuck downtown, which for some of you, if you remember the blizzard of 77, I know a lot of people who were stuck downtown because the buses could not run. And again, that happened during the October storm too. So we need to make sure that we are prepared at all times. Next slide, please.
So when you create a plan, here are some things to think about. We'd like you to plan to survive on your own for a minimum of 72 hours. We usually suggest 3 to 5 days as an average, but after the November snowstorm, some people learn that maybe 7 days is the way to plan. So you want to plan to be able to be ready for 7 days. And we'll talk a little bit more about what should be in those kits in a few slides. You want to create a personal support network. If you are unable to go somewhere, if you are unable to communicate, who would you be able to call that could let other family members and friends know that you're doing okay? And would that be through social media? Would it be through an app on your phone? Figure out how you're going to do that, write it down, and then everybody in that network needs to know that they are part of that network. You need to plan for your normal services to be unavailable. It might be water, it might be electricity, it might be the trash pickup, it might be the bus schedule. Those services might not be available, so you need to make alternative arrangements for the way you're going to have to manage without those services. You need to identify your family contact. That personal support network that we talked about just a few minutes ago, who will contact them from your family? Who from that group will contact your family? A great example from my own life was on 9/11. I was speaking at a conference in Oregon, and my nephew knew that I was flying across country that day, so he was a little concerned. And the only way we were able to communicate with each other with all of the cell phones down around New York City was that we had prearranged a family member in the middle of the country who was unaffected to act as our contact. So I was able to get in touch with that person to have this person let everyone know that I was okay. Again, that just helps alleviate the stress. Another important thing for you to do is to inventory your home possessions. And this is in case of fire or flood or a tornado. In order to get insurance reimbursement, including FEMA reimbursement, you need to have some record of what was lost. And a very easy way to do that is to take a video camera or take your cell phone, go room by room, videotape the room. If you have drawers in the room, you want to open those drawers so the contents can be seen. And then you want to put that video someplace safe, like in your fireproof box. And you might want to send it to a trusted person who can keep that for you also, in case your phone is one of the things that is damaged during the emergency. And then you also want to make copy of important documents, whether that's your will, whether that's the deed to your house, birth records, death records, divorce records, marriage records, your social security numbers, copies of your credit cards, any of that. Those are things that we want you to think about in your first step in creating the plan. Next slide, please.
We also want to make sure that you don't forget to learn basic first aid and CPR skills. Learn how to use a fire extinguisher. That is vital. Learn how to shelter in place, making sure that when you're in your home, when you're in your office, and you have your supplies, making sure that you have those things that make you comfortable. I know that Patty Ann has her teddy bear, so we want to make sure that everyone has those comfortable items to make them happy, because like Patty Ann said, you may be there for a while. And one of the things that we want to stress too is, the 72-hour period. We want to make sure when we had the November snowstorm, when we had the October snowstorm, keep in mind that people rely upon the governmental entity to rescue them or come to their aid. Unfortunately, during those emergencies, you may or may not be aware, but the resources that the county has and continues to have, those were getting stuck in the snow. So it may be longer, like Patty Ann said, it may be longer than 72 hours. So that's why we want you to make sure that you learn how to shelter in place and make sure that you're comfortable. Learn where your emergency alert notices come from. Be very aware. Where do they come from? They come from local law enforcement, reverse 911, from the radio, from the television, from your smartphone apps. Erie County has a Ready Erie app that is free. You could just go on the App Store and go to Ready Erie and apply for that. It's a great way to be aware of what is going on in our community at all times with regard to emergency situations. And then there's social media. But we also have to think about social media, and we have to be careful with social media and what we're reading with that social media. Next slide, please.
If you download the Ready Erie app, it will help you make a plan. It actually walks you through that. It will also help you develop your emergency friends and family contact. And you can actually use that app as a contact mechanism for your friends and family. And the next thing I would like you to know is that I really don't have a teddy bear. It is actually a unicorn, not a teddy bear. So speaking of unicorns, let's talk about making a plan for our pets and our service animals. So one of the first things that we want you to know are the laws regarding pets and service animals in shelters. And I'm going to ask Frank to join me in this one. Please note that service animals are always welcome by law in a shelter. However, emotional support animals are a completely different entity. So Frank, would you like to address that?
Sure. So understand that under Title II of the Americans with Disabilities Act, which is local state governments. That's those are the entities that Title II covers. Service animals are the only thing that is recognized by the Americans with Disabilities Act. And even under service animals, only dogs or miniature horses are recognized by the Americans with Disabilities Act as service animals. So if you have a pet, if you have an emotional support animal, and you would like to bring it into the emergency shelter, we may not be able to get that in. We may not be able to allow that animal into the shelter. If it is a service animal, we cannot deny you that right to bring that service animal in. But if it is an emotional support animal or a pet, that may be denied.
However, we would like you to know that in Erie County, when we set up a shelter for any length of time for humans, we also try to locate a nearby area where we can set up a pet shelter. We have some basic crates and some basic items to help support animals, but you will need to come and you will need to take care of your pet. But we do that because we know that sometimes people are very reluctant to leave their pet. That was the cause of many deaths during Hurricane Katrina, and that was why FEMA had directed emergency departments throughout the states to set up pet shelters along with people shelters. So that will also happen. So that's great for dogs and cats. But you'll notice that the second bullet down says to prepare for an alternative safe location for your pets. You should do that anyway. Is it going to be, is it going to shelter at your vet? Is it going to shelter with a family member? I just want to caution you that if you have an exotic pet, something like a bird, something like a reptile, they traditionally do not survive regular pet shelters because they require heat lamps and very specialized environments that most shelters cannot provide. So, for example, if you have a pet iguana, you might want to talk to other people who own pet iguanas a little further away from where you live so that you can agree to care for each other's iguanas during a respective emergency. That's truly the best way to do it.
And Patty, and I wanted to touch upon the service animal piece too. Again, the county employees or the state employees or the FEMA employees who may be at the shelter, they are, if you state that you have a service animal, we are allowed to ask you two questions. The first question being, is this animal for your disability? And the second question is what specific task does this animal serve? What specific task does this animal provide to you, the service animal handler? The animal must be leashed at all times. The animal must be in control. The handler must be in control of that animal at all times, and the animal must be well trained. And if that is not the case, then again, we may ask you to remove your service animal from the shelter, but we can't ask you to leave the shelter. We can only ask that your service animal leave.
So to help make it a little more comfortable for everybody, we'd like you to have a disaster kit and an animal carrier ready for your pets or your service animals. Have those at least 72 hours amounts of food, some water, animal waste pickup bags. Make sure you have leashes, harnesses, collars. Please make sure that your pets and service animals have the proper tags on their collars or their harnesses to assist in reunification. If one of them gets out of their crate, if it has tags on it, it actually helps us get them back to you faster. In that kit, also have copies of your pet or service animal's vaccination history and include contact information for your veterinarian. We would like copies of things like distemper vaccinations, rabies vaccinations, kennel cough vaccinations, all of that important information. Please also put a hard copy, a hard photo on paper of you and your pet or your service animal with you, so that we can, once again, if that animal gets separated from you, we can verify that this is the animal and the human that we need to reunify. So those would all be very helpful things for us. Next slide, please.
So we've talked about disaster kits, we've talked about ToGo kits, but what's the difference? Stationary versus portable. Next slide, please.
So the at-home kit, that's the stay kit. That is the stationary kit. And here are some of the things for you to have it. First of all, please make sure it's easily accessible in your home or office. If the power is out, you don't want it in the closet under 3 months full of camping equipment and Christmas bulbs and holiday ornaments. Make sure it's easily accessible. Please make sure that you have water for everyone in the household for at least 72 hours. And the standard is 1 gallon per person per day. And once again, don't forget your pets. Non-perishable food that you don't have to cook and that is easily opened. So either you need to have a crank can opener or you need to have something that you can pull open on a pop top or tear open. And again, you might not be able to cook. For example, if you have an electric stove and the electricity is out, it may not work. So you want things like perhaps crackers, peanut butter, protein bars, granola bars, some dried fruit. If you have special diets, please make sure that you have the extra things for that also. If you have children, you want to make sure that you have games and books to keep them occupied. Once again, once the battery runs out on the iPad, if your children are technologically dependent for their amusement, that could get very uncomfortable. Please make sure that you have copies of those personal documents that we just talked about previously. Please have a battery operated or a hand crank radio, particularly with a weather band. And a weather radio, I know that you've all seen pictures of them. They're made by several companies, but probably the most frequently one seen is the one by the Red Cross. And it has a little crank on it, and you can crank it up, and it works as a radio. Please make sure that you use flashlights or battery lanterns or flameless battery candles. We don't want any live flames in the house because we don't want to cause a fire. And since we're using so many battery items, we want to make sure that you have extra batteries. Please make sure that if you have a medical device or you wear a hearing assistive device, that you have batteries for those also. Please make sure that you have enough supplies of your prescription medicine and any over-the-counter medicine. And it's always good if you're taking prescription medicine to always have a written list of that medicine. Make sure you have a first aid kit. If you think back to one of the slides, Frank talked about the importance of knowing first aid and CPR in case the responders are delayed. So make sure you know how to use the items in that first aid kit. Make sure you have a change of clothes for members of the family. Do you have clothes to keep you warm if the heat goes out? If the electricity goes out and it's the summer and the air conditioning isn't working, do you have less warm clothes to wear? Do you have some shorts in there? Do you have things to wear that'll keep you cool? Make sure that you have blankets or sleeping bags for cold weather, and have an emergency whistle in there. Now, we don't use those too much here in Western New York. People who live in Tornado Alley always have emergency whistles in their kits so that if their house gets damaged and they're trapped under something, they can blow the whistle to help emergency responders find them. So it's not a bad idea. It also helps you get your kids' attention if they're not paying attention to you. Always have some hand sanitizer and some personal hygiene items. If the water is out and you can't do it, hand wipes, handy wipes, body wipes are great things to have for personal hygiene items. And you're going to need some plastic sheeting and duct tape for sheltering in place during a hazardous materials incident. And that's a whole nother presentation that we'll do another time to teach you how to do that. And you should always have some cash on hand because if the electricity is out, the ATMs might not be functioning. Next slide, please.
So now we're talking about ToGo kits. So this would be if you're in your office, or if you are in your car, or if you are on vacation. We want to make sure that, again, you are prepared. And that the ToGo kit is very similar to the kit for when you're at home. There are a few different changes, but I guess the most important difference is it has to be portable. and you have to be able to take it to an evacuation center or shelter. But again, you want to have water, you want to have non-perishable snack items, you want to, again, have games and books for the children, pen, paper, you want to have your important personal documents, your personal hygiene items, a first aid kit, the over-the-counter medications and your personal prescriptions, and, as Patty Ann said, the last one, a list of those personal prescriptions, because if you are somewhere and if you end up going to a shelter, they may need to know what specific prescriptions you are on. Patty Ann mentioned a battery-operated flashlight. It's the same. Extra batteries, a clean change of clothes, bedding. Keep in mind, you're not at home. You are somewhere else. So a sleeping bag, a pillow, a blanket, whatever it is, again, those items of comfort. And cash, because cash is so important. Like Patty Ann mentioned, the ATMs may not be working, so you need to have cash. And Patty, we have the last item, things that make you feel comfortable. I've talked about that a few times, but yeah, you need those things that will make you feel comfortable, because you may be in that position for longer than you really want to be.
A good example of that is it's very bright in a shelter. There are overhead lights. So you might want to put one of those little eye masks on so that to help you sleep in a shelter. Also, if you utilize a hearing aid, please have an extra place to store that hearing aid. We have a couple of those that have the desiccants in them to help keep them dry. But please, if you have an extra one of those, put that in your to-go bag also. Next slide, please.
Just like you have a to-go kit for yourself, you need a to-go kit for your animals. And just like the list we've provided for yourself, very similar for the animals. There's a few changes, because you're not going to have a water or food bowl for yourself, but you're going to need one for your animal. You're going to need medications for your animal. You're going to need pet waste bags. You're going to need that extra collar and leash and harness. You're going to need a blanket or a towel. You're going to want a recent photo with yourself, with the owner, and you're going to want toys. But you also want an unwashed piece of clothing from the owner as a comfort item. Again, I keep going back to the comfort. I should say, Patty Ann and I keep going back to that comfort items. Those are going to be very important to you as time goes on. Keep in mind, you may be in a shelter, you may be in your office, you may be in a place that you're not comfortable with for more than 24, more than 48, more than 72 hours. So you want to make yourself as comfortable as possible. Next slide, please.
So it's great to have kits and it's great to have plans, but we have to update those. You also need to practice your plans. We all know that we change the batteries in our smoke detector at least every 6 months. Change your clock, change your batteries. That's a great time to practice all of your emergency plans. Take that kit out, check the items in it. You really don't want to eat a 3-year-old granola bar. We don't really think they can get any drier, but trust me, they do. So please check those items. Keep your information updated on a regular basis. I can tell you that from working in shelters, the most frequently unupdated item, if you will, is the medication list. So please keep that medication list updated. Hey, let your outside contact know where you keep your kit and what your plan is in the event of the disaster. Maybe there's a neighbor you trust, friends that live nearby. Let them know where all of these items are. It's really important to include your neighbors and your friends and your family in your plan, because Buffalo truly is the city of good neighbors. And whatever we can do to help each other get through this would be great for all of us. Next slide, please.
Next, we want to talk about access and functional needs considerations. Next slide, please. So
let's talk about what an access and functional need is. We have a friend who always says, if you live long enough, you will have an access and functional need someday if you have the privilege of growing older. So if you have an access or a functional need, things may be a little, I don't want to say difficult, but an extra challenge for you that you're going to be facing in a disaster. Temporary evacuations or relocations may be taking place. And when that happens, that usually takes place very, very, very quickly. Communication is sort of clipped and not as clear as we would like it to be sometimes, and we need to be ready for that. Your familiar support network might not be available. For example, if you come into a shelter, of course, if you tell us you would like an ASL interpreter, we will attempt to get you one. But if all of the roads are covered in snow and there's a travel ban, then that interpreter may not be able to get to you right away. So we want to make sure that if you have a talk-to-text device, make sure that you have your phone charged at all times. Bring a phone charger with you so that we can try to overcome these challenges that you may face at that time. Next slide, please.
So, but before we go to this next slide, I want to actually kind of give a description of the difference between a disability and an access and a functional need. And people under the access and functional needs category, it's a little more encompassing than people with the disability. People with an access and functional need, they may be somebody who has limited English proficiency. They may be somebody who is pregnant. They may be somebody who has obesity. Things that are not necessarily a disability, but that prevents somebody from I guess experiencing life like the normal population. I shouldn't say normal population, but the general population. So we want to make sure that you understand the difference between access and functional needs and disabilities. So let's talk about, actually, we're going to talk about specific populations right now. We're going to talk about children and teens. We want to make sure that when we're talking about children and teens, that we're sitting and talking, anytime we're talking about an emergency plan, that we want to encourage the family to get together and speak to their children and the teens about creating that plan together. We want you to know where you will meet your family if a disaster occurs when you're not at home. Ironically, I'm sitting here watching the screen, and we're providing this information to you. And along on the screen, something about the Alabama floods just came on. Imagine if you were in Alabama right now, and all of a sudden you have 8 feet of water coming through your house. That is a true emergency, and that is something that we are talking about right now. We want you to be proactive. We don't need you to be reactive. We need you to be proactive. That's the whole idea of this slideshow and this discussion. We want you to designate and know phone numbers of family members outside the area, like Patty Ann talked about. Again, creating a list of medications or items that you may be allergic to. We want you to make sure that you're following the instructions of emergency response officials. If they're telling you not to go under the bridge because the bridge is flooded, they're telling you that for a reason. We want to make sure that everyone gets out of these things safely. And you know what? Don't be afraid to ask questions. There's nothing wrong with it. We're here to help you out. County employees, state employees, FEMA employees, they're here to assist. One of the important things that you need to always have with you too, Patty Ann alluded to already, a recent picture with family, a hard copy, not just on your cell phone.
And if I could just jump in here and add about emergency response officials, if somebody's knocking at your door saying, I'm a member of law enforcement and you need to come with me now, it's absolutely okay to ask for identification. It's absolutely okay to check a badge number. It is absolutely okay to pick up that phone and call 911 and verify that that person is who they say they are. We want you to take the normal safety measures that you would at any time. Next slide, please. So let's talk about culturally diverse populations. If you come from a culturally diverse family, for example, I grew up in a neighborhood where everybody immigrated after World War II, and we heard all kinds of different languages spoken, and it was really great. And so this always comes up for me because I want you to be prepared to help us help you. So again, you need to develop a plan for contacting your family and friends if you are separated. Have some key information about yourself written down in English and in your primary language, both of those. I can tell you as a child who did a lot of interpreting for some of the elders in our neighborhood, sometimes we put children in a position of being an interpreter that they really shouldn't be in, and that's really an unfair expectation for them. So please have key information about yourself written down. Okay, know where to go to find the information in your primary language. Is it a Facebook group where the information is written in your home language? If you have elder family members who maybe speak even less English than you do, make sure that they know how to access that also. Okay, if you don't know how to speak English, learn some key phrases to ask for help or how to get directions. Just like if you were going on vacation to another country where English was not spoken, you would want to learn how to say help in that language. You would want to learn to ask, where's the fire department? Where's the police department? How do I get to a doctor? You would want to learn some key phrases in there. Okay? You want to develop relationships with emergency response staff prior to your emergency. Get to know your local fire department. Walk down to the firehouse, knock on the door, say hello, bring them some cookies, bring them some cupcakes or something, say hello. Let them know that you may need a little extra assistance in an emergency and how to best assist you. Sometimes people think that we as emergency responders know how to do everything. You're the person who knows yourself and your disability better than any of us ever will. So we invite you to please teach us how we can best assist you with that. Okay? And be willing to follow those instructions of uniformed officials. Now, if somebody's knocking at your door at 3:00 in the morning and you have verified this is actually a member of the fire department, you look out your window, you see the fire department, and the lights are going and the siren's on and they say it's time to go, guess what? It's probably time to go. Next slide, please.
So now we'll talk about the deaf and hard of hearing community and what we need to make sure that you have. Patty, we've talked about extra batteries. Here we go again, talking about extra batteries for hearing aids, for your implants, for your laptop, and any other communication devices you may have. Have a battery-operated television.
And I'm going to jump in here because Frank laughed at me yesterday when he saw that slide and he said, do you think anybody really knows anymore what a battery-operated television is? And I said, yeah, they do. They still make them. If you don't have a battery-operated television, I guess your phone takes that place these days. I'm just a holdout. I'm just a holdout.
And so we also need to know which media outlets provide captioned emergency information. We need to create a list of pre-printed statements and explanations describing your needs. This goes to having that relationship with your emergency management folks, with the fire department, with the police department. We need to make sure that you keep pens and paper in your emergency kit for writing notes. And before disasters occur, reach out to your local responders and offer to hold basic ASL classes. I'm sure that they would jump on that. Next slide, please.
All right, if you are a senior or if you are taking care of seniors, please consider their personal need and assistive devices such as eyeglasses. Maybe they have hearing aids, maybe they need a walker, maybe they utilize a cane. We have some basic assistive devices in the shelters in Erie County, but as you all know, your walker is the one that fits you best rather than just a standard issued size one. So please make sure that all of those are ready to go. When you bring seniors to a shelter, please make sure that their to-go bag has ample layers of clothing in the Go Kit to keep warm. Shelters are either really, 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 really warm or really, 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 really cold. I've never met one that has an optimum temperature yet. Keep those copies of pre-printed messages that explain your needs and how to best communicate with you. We do have picture communication boards for all of the shelters in Erie County, but if you have a particular one that works best for you, then we would encourage you to make a copy of that and bring it with you. And once again, here it is again, a recent picture of yourself with your family. And that's for safety reasons, particularly with vulnerable populations. If you're taking care of a family member that maybe is in the beginning of dementia or Alzheimer's or a very young child, we want to know that it's safe to send this person with another person who says that they know this senior or that child. So we need a recent picture to keep everybody safe. Next slide, please.
I'm going to let you talk about this.
Okay, so let's talk a little bit about fire prevention. A home fire is probably the most common emergency that most of us will face in our lifetime. So if you have kids, you know that the first couple of weeks in October, because October is Fire Prevention Month, they come home and they say, we need to practice Edith. We need to know Edith. Well, Edith isn't the name of a woman. Edith stands for exit drills in the home. And that's just a way for you to plan how to get out of your home in case of a fire. So you're going to want to sit down again with all of the family members to discuss this. On a piece of paper, you want to draw an escape plan from every room. So take a piece of graph paper, a regular piece of paper, make a rectangle, make a square, and draw your rooms on it. You're going to want to identify 2 ways out, if you can, from each room. Put in the windows in that drawing, put in the door, draw take arrows and draw escape routes. If you have bedrooms or you live in a 2nd story or a 3rd story apartment, you might want to consider escape ladders for levels above the ground. Please make sure that you buy a reputable one that has been certified by a laboratory such as Underwriter Laboratory. Make sure that you have a good label on that from a good testing company. Please practice good fire prevention habits. You know, we're coming into the holiday season, and it's very sad the number of home fires that happen at this time of the year. Number one, from people cooking and not paying attention in the kitchen, or candle fires. So you want to practice those good fire prevention habits. And again, this is another great discussion for you to go to your local fire department and invite them in to come and do a presentation for you. Next slide, please. So what you want to do is on every level, have a smoke alarm near your bedrooms, in your kitchen, and in your laundry room. And people frequently say to us, well, I don't want to put a smoke detector in my kitchen. Then it goes off every time I cook. And I always smile at people and say, if that happens, if your smoke detector goes off every time you cook, the answer is not taking the batteries out of that smoke detector. It's learning how to cook so that you don't set the smoke detector off. And they now even make smoke detectors for the kitchen that if you accidentally set it off making toast, you can push a button and it resets the alarm in 2 to 3 minutes. Okay, so the next question, Frank, you want to talk about hardwired or battery?
So you do have options with regard to smoke and fire alarms. And as Patty had alluded to, there are hardwired smoke alarms and there are battery operated smoke alarms. Keep in mind that both of them, they do have a lifespan of about 10 years, either the battery or the hardwire. I will tell you that the battery, we want to make sure that you are changing every spring forward and fall back. So that would be twice a year, because you want to make sure that that battery is fresh in that detector at all time. We want you to be aware that the hardwire, it only has a life of 10 years. So I can tell you this personally because I had this happen to me about 6 months ago. I was awoken in the middle of the night. I should say I was awoken in the middle of the night by a loud chirping and a sound that said fire, fire, and I ended up running downstairs, and it was my smoke detector, which is a hardwired smoke detector, and soon realized, because I didn't know that they only had a life of 10 years, I learned a quick lesson. So keep in mind that may happen. So we also want to make sure that, especially in the deaf and hard of hearing community, that the smoke and fire alarms that they are strobe. There are strobes, and that will alert somebody who is deaf and hard of hearing to when an event is occurring. So general smoke alarms produce a loud sound, a loud high pitch, and they're activated by the sound of a smoke detector. So sometimes you want to install it next to the bed. You want to have them in every area of your house, in every level, in your bedroom, in your kitchen, in your laundry room.
We also want to remind you that if you just bought a brand new smoke detector, you can't change the battery every 6 months. That smoke detector is sealed because it has a lithium battery in it that is guaranteed to be good for a 10-year span. And if you flip the bottom of that smoke detector and look at it, it actually has a tag on it. And you want to be careful because it's not 10 years from the day you bought that smoke detector. It's 10 years from the date that smoke detector was created and that battery was put in. So when you go to buy one, and by the way, this is a good month to buy them because they're usually on sale because it's fire prevention month, you want to check the date on it. So there may be some changes coming to smoke detectors for everybody, whether you are deaf, hard of hearing, or in the hearing community. They are finding that smoke alarms work better if they have a mixed low-pitched sound rather than the high beeping sound that they're currently making them with. So you may see that change. Next slide, please. Along with the smoke detector that Frank talked about with the high intensity strobe lights that will activate, especially in your bedroom, there are alerting devices like a pillow or a bed shaker that will also wake you up at the sound of the alarm. Next slide, please. So where can you purchase these items? Well, you know that you can purchase a smoke detector at any home improvement store or on their website. You could do an internet search for strobe light smoke alarms. And the most common companies that you'll find are probably BRK, First Alert, Kita, Gentex. And there are also companies that sell the accessories such as the shakers and the transmitters and the receivers. And we put those up there for you, lifetonesafety.com, safeawake.com, Silent Call, and there may be more out there. We are not, as the health department, endorsing any particular company or product. We just want you to know that if you do a good internet search, you can find the equipment that works best for you. Whatever equipment you buy, please make sure that it has a label recognizing a standard testing laboratory, such as Underwriter Laboratories. You know, if you're going to the store and you're buying a strobe smoke detector, smoke alarm, and it's $2.99, I probably wouldn't buy that smoke detector because it's probably not tested from a laboratory. So please make sure, check that label on there. And you, of course, you all have to research products and select the ones that best meets your individual needs. Next, please.
The important thing is, and the reason why Patty Ann and I are here with Deaf Access Services, we're all in this together. We all have to work together. We all have to teach each other. We are learning things. We're learning things from Deaf Access Services all the time. Patty Ann and I work with the local disability community. We work with Deaf Access Services. We work with everybody just because we want to make sure that all of the communities are being served properly. So we need to make sure that if there's any information you want to teach us, we're here to learn. The Erie County Department of Health has many presentations on personal preparedness and safety for all ages.
And
so if you want any other information, let us know.
And also, as Frank said, I just want to reiterate, it's important for us to learn from the communities that we serve too. We would love to hear from you. If you have an idea for a presentation, if you would like to come and teach some basic signs, some basic skills to our Medical Reserve Corps, whatever it is that you think we need to know to be true partners in the preparedness community, we are happy to assist. Next slide, please. So here's where you can go for questions. On the screen right now is Frank's information, his contact information right up there, and below it is my contact information. So feel free to utilize those. We would love to hear from you. We always love to learn new things, and we value your input to let us know how we're doing. And that's all Frank and I have.
Thank you so much.
We really appreciate the opportunity to be here today. Thank you. Have a safe and happy fall and winter.
And please be proactive. Get those plans in place. Please make sure that you have that to-go bag. Please be prepared.
Have a great night, everybody. Stay safe.